Case Study 12. Pregnant woman at risk for preterm labor.
Yeah, come in.
Hi, Keisha.
Hi.
My name's Amanda. I'm your nurse today.
Okay.
Can I have you sit up?
Yeah, sure.
Okay.
Okay.
All right, Keisha. As I explained, I'm going to be your nurse. I want you to know that everything we say here today is going to be confidential. Okay? It will not leave this room. I just spoke with your OBGYN. He looked at your urinalysis and did the results of your physical exam. I understand you came in because you thought you were pregnant?
Yeah, I haven't been to the doctor yet.
Okay. All right. So this is your first visit?
Yeah.
Okay. Well, the results did come back positive, and you are pregnant at 15 weeks gestation.
Oh, all right.
How do you feel about that?
Okay, I thought I was pregnant, so
Yeah.
not really a surprise.
Okay. Well, do you mind if I ask you a couple of questions here?
Sure.
Okay. All right, Keisha, how old are you?
I'm 24.
24. Okay, and what's your ethnicity?
African American.
Okay. And are you single or married?
I'm single.
And can you tell me your past history of any pregnancies you've had before?
Well, this is my fourth time being pregnant. I had 2 miscarriages. One was at 13 weeks and one at 14 weeks. And I do have one daughter who's 4, and she was born at 30 weeks.
So she was preterm.
Yeah.
Okay. Okay, now I'm going to ask you a couple of questions about your health history. Do you smoke, Keisha?
Yeah, I do smoke. I smoke about 1 to 2 packs of cigarettes a week.
Okay. And do you drink any alcohol?
No.
Okay. Do you have any chronic health problems?
What do you mean chronic problems?
Meaning diabetes, high blood pressure, any frequency of UTIs, bladder infections?
Yeah, I have high blood pressure since I was 20. Okay. And I get a lot of bladder infections.
How often would you say?
About once a month.
Okay. Okay. And do you have any concerns right now that you'd like to talk about?
Well, I'm stressed out because my boyfriend, he just started to pick fights with me more often, and he started to hit me since I've been pregnant, so I'm stressed because of that, and I'm just worried because I don't want to have another premature baby again.
Okay. All right, Keisha. Well, I'm going to go over some risk factors over your history, and we're going to discuss those more in depth here.
Okay.
Pause. Hey nurses, what do you think Keisha's risk factors are for preterm labor?
Okay, Keisha, now that we went over some of your risk factors involved, I'm going to ask you a couple questions about the father of the baby.
Okay.
You did mention he is physically abusive. Is he also psychologically abusive or sexually abusive?
No, he's just started to hit me lately since I've been pregnant, and it's just really stressing me out. Like, I just don't know when he's going to lose it.
Okay. And on that note, are you afraid of your partner?
Well, I'm not afraid of him. Like, I can handle it. Like, I'm not worried about myself. I'm just really worried about having another premature baby, and I'm just really confused because I don't know why this has all started since I've been pregnant.
Right. I'm sure you're very confused, and you need some answers and clarity on why is he doing this now.
Right.
Because he has picked fights in the past but never hit you, and now he's hitting you when you're pregnant.
Right.
Okay, well, we can definitely talk some more about that.
Pause. Why do you think Keisha's boyfriend has started to hit her now that she's pregnant?
Okay, Keisha, now that we've gone over some of your risk factors and why your boyfriend has been hitting you, do you understand a little bit more and see a way that you could possibly prevent it in the future?
Yeah, I get what's going on, but I mean, I just really can't leave him right now because I need him for money and I need a place to stay. I really don't have anywhere else to go.
Okay, so you're deciding to stay with your partner.
Yeah, I need to stay with him.
Okay, well, I want you to know that it's solely your decision, and I respect that, and I will still provide you all the support. It is very important, however, that we keep an open communication and that you develop an exit plan in case that you feel very unsafe, you have a place to go to. Here's a pamphlet full of community resources.
Okay.
There's also the police station number and shelters that you could seek in the event that you need to get out of the house.
Okay.
Okay? Okay, and do you have any other worries now, Keisha?
Well, I'm fine with dealing with my boyfriend. Like, I can take that stuff, but I'm just really worried about having another premature baby. And everything happened so fast when I had my daughter at 30 weeks. Like, I just don't even know what to look for or what to expect.
Okay, so I can go over a couple of signs and symptoms of preterm labor.
Okay.
Okay, one is contractions. They explain it like a tightening of your abdomen, like this tightening up, and that happens about every 10 minutes. Another sign or symptom to look for is any leaking from the vagina, any kind of fluid or bleeding, any pelvic pressure. You'll feel weight down there. You may have a low, dull backache, so right down here. Cramps that are similar to menstrual cramps you could feel, and any abdominal cramping that could be with or without diarrhea. If you experience any of those, do not hesitate to call us and come right in because that is the sign or symptom of preterm labor.
Okay. I was under the impression that those things were like normal during pregnancy.
No, not at all. Although some of those may be experienced during normal pregnancy because you are at risk for preterm labor, we don't want to treat it light, and we do want to see you immediately. So call right away and come right in.
Okay.
Okay? And on that note, if you do experience any of those at home, it is advised not to have any sexual intercourse, no masturbation. You do want to drink some water, lay on your side until you can be brought into the hospital. Okay?
That's going to make things worse with my boyfriend if we can't have any sex.
I know, and that's why I want to go over this with you right now, and that's why it's very important to have an exit plan in the event that he gets violent again.
Okay.
Okay. All right.
Pause. Let's see how Keisha does with recognizing these signs and symptoms at home.
Yeah.
Hi, Keisha. It's Amanda.
Hey, Amanda.
Baby?
Yeah.
How are you doing?
Well, I'm not too good because I've gone into labor at 24 weeks.
Yeah, I just spoke with your OBGYN, and he did say you came in with concerns of going into preterm labor, and you were right. So I just want to say that was a great job in recognizing the signs and symptoms we went over and coming right in. Your doctor said he gave you some tocolytic therapy with magnesium sulfate.
Yeah, he gave me some medication, so I don't really know what went on.
What that does for you is it slows down your contractions. So it looks like that was effective, and we've got your contractions suppressed right now. We are sending you home with a terbutaline pump, and we're also going to set up a home uterine monitoring program where somebody's going to come in and monitor your uterine contractions, okay?
Okay.
I've got to let you know there are some signs and symptoms and contraindications for this terbutaline pump. One thing that has been noticed is that it will cause maternal heart problems, and it may cause fetal death. However, we're not going to let it get that far. We're going to take good care of you, okay? Other signs and symptoms it could cause is increase in heart rate. It could help you, or it could cause you to get hyperglycemia, which is high blood sugar. In that case, you could experience blurred vision, headache, nausea and vomiting, some cramping, or you could get hypokalemia, and that would cause you to have muscle weakness. You could have frequent urination, dizziness, or sweating. So if you experience any of those signs and symptoms, give us a call right away and stop taking the medication, okay?
Okay.
Okay. All right. Do you have any other questions for me?
No, just thanks being such a great nurse, and hopefully this all will work out.
Thank you, and it will. And I just want to remind you to keep up on your prenatal appointments and any kind of home arranged appointments you have. Please be home up there on time and let that healthcare provider in. It's very important that we keep seeing you on these appointments and monitoring you very closely to make sure that we get you to a term delivery.
Okay.
Okay?
All right.
All right. We'll talk soon, Keisha.
Thanks.
Okay, thank you.